Hello, I'm Darren Magee, and today's question asks if I would discuss dissociative disorders. Now, if you like this video, if you find it helpful, please consider subscribing to my channel. But just as a reminder, this video is not a substitute for support from a mental health professional, nor is it a tool to be used to diagnose someone. So in this video, I'm going to try to outline what dissociation is, the three different kinds of dissociative disorders, and where they come from. But first of all, I would like to say that all of us dissociate from time to time. Now, even just walking into a room and forgetting what we walked in for, or coming home from work, coming home from a journey and actually forgetting the journey. There are different kinds of dissociation. But a dissociative disorder is something different, and it could be characterized as an involuntary escape from the moment, from reality. There is a disconnection from thoughts, from memory, from consciousness, from identity even. And for it to be a disorder, the symptoms have to be present over a long period of time. They have to be persistent, pervasive. And I often tend to think of a disorder as looking at the impact it has on a person's day-to-day functioning, as well as the impact it has on the relationship with themselves and with the world around them. Now, some of those symptoms include a lack of a sense of purpose, a lack of a sense of identity rather. Who am I? Where do I fit in here? What is my role? What is my purpose? There can be memory loss around specific times, periods of times. There can be memory loss around events, around people even. Some people with dissociative disorder can sometimes have difficulty remembering huge chunks of their day or huge chunks from their childhood. Some have described being in a stressful situation or remembering a traumatic, stressful event, but feeling as though they were outside themselves watching it. They've described what could sometimes be considered like an out-of-body experience. It's almost like they're outside themselves watching it as if they were watching it on television. There can also be a detachment from feelings, emotions, like there can be an emotional numbness. There can also be other various mental health related problems present, such as anxiety, depression. There can be thoughts of life not worth living and suicidal thoughts. Now, according to the DSM-5, there are three different kinds of dissociative disorder, and the symptoms often depend on the type of disorder. But also I think it's fair to remember that these disorders can be comorbid with other mental health conditions and with other personality disorders. So the first one is dissociative amnesia. Now, for someone with dissociative amnesia, the main symptom would be a difficulty remembering important information, even important information about themselves. Or the amnesia could be around a certain event or events, such as, say, abuse, assault, or having been in combat. There can be amnesia around their own identity, their own life history. Now, an episode of dissociative amnesia can last from a few minutes to a few days, but in some rare cases can last for months or even years. Next, there's dissociative identity disorder. Now, this was previously known as multiple personality disorder, and this could be characterized by alternating between different identities. Now, someone with this disorder may feel like they have more than one identity or more than one personality trying to take control of them, even though sometimes those identities or personalities can function without the person being aware. And those personalities can even have different names, characteristics, traits, mannerisms. They can experience gaps in just even everyday events, as well as gaps in their own personal information. But lastly, there's depersonalisation disorder. And this involves ongoing feelings of detachment from their thoughts, feelings, actions, behaviours, sensations. Now, as said earlier on, it's been described like sometimes watching themselves as if from the outside. There can also be derealization, as if the world around them is unreal. And the symptoms can last from, say, a moment or two, but it is recurring over years. But regardless of the type of dissociation, what we see is a defense mechanism to extreme trauma, to extreme stress, to feeling overwhelmed. Now, consciousness has been disrupted. Now, when I say a defense mechanisms are perfectly normal. We all have them. A defense mechanism is our way of protecting ourselves from thinking, feeling, or experiencing something really unpleasant. And this defense mechanism, dissociation, is usually, though not always, but it's usually associated with childhood trauma such as long-term physical, psychological, or even sexual abuse. In cases like this, it's not uncommon for someone to not be able to remember huge chunks from their childhood. But it can also develop through having, say, experienced combat, having been in combat, or having been exposed to some kind of natural disaster. And someone with a dissociative disorder can find themselves being hypervigilant to perceived threats. And when that defense mechanism is triggered, the person, it's like they disconnect from themselves, from the moment, from reality, as a way to stay safe. It's like yesterday's threat, yesterday's situation is present today, and that threat is overwhelmingly difficult. It is painful, it is terrifying. And that dissociation is a way of trying to keep those traumatic memories and experiences at bay, developed as a result of the original trauma. Now, the means of escape is involuntary, but it is also quite unhealthy and dysfunctional and can cause a lot of problems with day-to-day functioning, as well as with interpersonal relationships. Now, treatment can be difficult, but it's not impossible, and treatment usually involves a combination of medication as well as psychotherapy. So that's a brief outline of dissociative disorders. Now, if you would like me to go more in depth on them individually, by all means leave a comment to let me know that, and I'll certainly get around to it. But as always, if I've forgotten something, if there's anything you might like to add, by all means please use the comment box below, and there are some interesting conversations starting around these videos. But if you like this video, if you find it helpful, please consider subscribing to my channel for future updates on mental health related topics, and until next time, thanks for watching.